It was a Monday, and both my body and mind felt heavy. After finishing morning exercise therapy for inpatients, I headed to the intensive care unit in the afternoon. The ICU is a place for patients in critical condition. Some are unconscious, while others are awake but require absolute bed rest. If they improve, they move to a general ward. If not, they face a long, uncertain stay. Prolonged immobility leads to stiff joints and muscle atrophy. In severe cases, phlegm accumulates in the lungs, leading to pneumonia. To prevent this, physical therapists perform exercise and respiratory therapy. While we cannot provide high-intensity functional training as we do in the gym, even simple movements in the ICU can be a vital foundation for a patient's future recovery. My first patient in the ICU was a young woman in her early 20s who had fallen into a coma after a traumatic brain injury. She had been hit by a bus with failing brakes while crossing a crosswalk. Despite undergoing emergency surgery and spending over 2 months in the ICU, she remained in a coma, her life hanging by a thread. The sight of her parents standing behind the crack of the ICU door, desperately gazing at their daughter, always broke my heart. As her therapist, I constantly agonized over her treatment plan, but I knew my concern could never match the heartbreak of parents. Watching their child in such a state, it pained me even more to see someone so young confined to a hospital bed. On the first day, I assessed her condition. Fortunately, aside from the brain injury, there were no other complications. The surgical scars on her head were prominent, and she had a tracheostomy, a hole in her neck to assist with breathing. She was surrounded by a maze of equipment, a ventilator, a pulse oximeter, and IV pumps. Beside her bed, a monitor blinked with her heart rate and respiratory status. Providing therapy amidst the mechanical beeps, the smell of disinfectant, and the bustle of medical staff was challenging. Above all, the hardest part was the inability to communicate with a comatose patient, though I felt a deep responsibility toward her parents, who were desperately waiting for her to wake up. Focusing on therapy in the precarious environment of the ICU was often difficult. Before starting, I would briefly introduce myself. Hello, I'm the physical therapist here to help keep your joints and muscles from stiffening. I would slowly explain why we were doing the exercises. Seeing me talk to a non-responsive patient, nurses passing by would sometimes give me strange looks. I don't remember exactly why I did it, but perhaps I felt it was a minimum show of respect for her and her parents. From then on, I shared a new story during every session. What I ate with friends, TV dramas, stories of other patients who got better, or just things I saw from the bus window. I spent those 10-minute sessions talking about everything and anything. In truth, I didn't think it meant much. I talked mostly to keep myself from burning out in that heavy silence. Since she was unconscious, I couldn't track her progress, and I often felt that maintaining her vital signs was more crucial than physical therapy. After about a month, her condition finally stabilized, and she was moved to a general ward. As our therapist changed, our paths diverged. About a month later, during a slow day, I received a referral for an inpatient from the neurosurgery department. The name looked familiar. I checked her chart. It was her. She had woken up from her coma after moving to the ward, and her breathing had improved enough to remove the tracheostomy tube. I was curious to see her. Just a month ago, she had been staring vacantly at the ceiling, dependent on machines. The fact that she was conscious was nothing short of a miracle. When she finally arrived at the gym in a wheelchair, she looked much better than I had imagined. It was hard to believe she had been bedridden for months. While most patients look around curiously in a new place, she kept her eyes fixed on me with a clear, recognizing gaze. The pale, short-haired patient with surgical scars was gone. Her hair had grown back, and her face had regained its healthy glow. I moved her to the treatment mat and assessed her range of motion and muscle strength. Aside from some stiffness on her left side due to the brain injury, her overall condition was excellent. She began coming to the gym every late afternoon for an hour of functional training. Then, one day, she suddenly spoke to me. "Do you still drink a lot these days?" I was speechless. I had actually been feeling a bit tired after having beers with a friend the night before, and I thought she had just read my face. But as we kept talking, she said something that shocked me. She couldn't remember the accident or the surgery, but she remembered everything that happened after that. Even during the 3 months she was supposedly in a coma. Though she appeared comatose, her eyes and ears had been open to the world. The medical staff simply hadn't known, or rather, perhaps no one had bothered to consider the possibility. Unknowingly, I had apparently told her quite a few stories about my drinking habits while she lay in that ICU bed. Few people believe that a patient who shows no reaction is actually conscious, but it seemed my idle chatter had been a great source of comfort to her. Thinking about how difficult it must have been for her to be trapped in a motionless body for over 3 months, watching people pass by without a word, made my heart ache. In the silence of the ICU, she might have been longing for just a single word. My stories were simple and brief, but their resonance for her was longer than anything else. Perhaps that was why she trusted me so much and worked so hard in her sessions. By the time she could walk well, she was discharged. She wasn't fully recovered, but she walked out of the hospital firmly holding her parents' hands. On the day she left, as she gave me a bright smile and a nod, I thought back to our first meeting in the ICU, realizing that my words had given someone strength. I vowed never to treat my words or actions lightly again. They say the difference between a luxury good and a knockoff lies in the details. You can mimic the appearance and the brand, but you cannot copy the deep sincerity and pride within. A luxury bag is finished perfectly, even in the places no one sees. The same goes for physical therapists. Rather than seeing it as just a job, we must first have the attitude to empathize with and touch the patient's heart. Every physical therapist should strive to be a masterpiece because we are the ones patients meet in their most difficult and vulnerable moments.